All right, it looks like we've got everyone coming in from the waiting room. So thank you for being here today for our next CPH review session. Today's session is on policy and advocacy, and it'll be presented by Molly Pulverento. My name is Ashley Mueller, and I'm the manager of educational programs at NBPHE. So today throughout the session, I'll be monitoring the chat. It is still open for you to interact with your fellow attendees. So say hi to everyone. Feel free to interact throughout the session. If you have a question for our presenter, please submit them in the Q&A section and we will address them at the end of the presentation. So a little bit about Molly. Molly is a senior outreach specialist in the Department of Family Medicine at Michigan State University. In this role, she supports two statewide networks supporting the education and professional development of family medicine physicians, as well as working with physicians in governmental public health. Molly has served in elected and appointed leadership roles and has professional experience in program development and evaluation, policy development and evaluation, and development of continuing education opportunities for public health professionals. So with that, let me join you all in welcoming Molly for today's presentation.
Thank you, Ashley. Good afternoon, everyone. Although if we have any West Coast, good morning. I still have to check my East Coast, Eastern Time Zone orientation. I am in very cold East Lansing, Michigan right now. So I know seeing several people pop up from some of our southern states, and I know that you're getting some unseasonably cold weather as well. I will apologize in advance. It's cold enough here that my kids did not have school today. So they have been told to be quiet for the next 2 hours, and hopefully they will do so, but I cannot guarantee. So if you hear anything in the background, I will apologize. And I'm going to share my screen. I'll share the slides. As Ashley said, I work with some statewide networks and have experience serving in a couple of roles related to policy. I'm trying to get to my slideshow. And currently serve as a member of my local school board. So I'm actively involved in policy making here at the local level. So happy to answer any questions or at least try. I look forward to seeing what pops up in the Q&A. Ashley will also help me keep an eye on everything. So welcome. Today's agenda, we're going to talk about policy and public health professionalism and practice. What does that mean? And then we're going to talk through kind of the steps for policy development and implementation. So starting with agenda setting and really developing policy, then advocacy, which is always one of those loaded words. So we're going to talk about advocacy versus lobbying or advocacy versus education. We'll talk a little bit about that and how advocacy translates into policy adoption. Then we'll talk about policy implementation, which is a whole other thing. And I think sometimes gets everybody thinks that's an easy part. Well, once you've adopted the policy, it just goes into effect. But there's a lot of work that goes into policy implementation. And then we'll talk about evaluating policy, and we will do a few practice questions. So what is health policy? Before we get going, if you have questions, like I said, Ashley's going to keep an eye on the Q&A. I'm okay with being interrupted. So Ashley, if anything pops up that relates to a slide we've just done, go ahead and let me know just so we don't get too far ahead and then have to go back. So what is health policy? So I have a WHO definition, which we're still going to use, but health policy is defined as decisions, plans, and actions that are undertaken to achieve specific healthcare goals within a society. So it's pretty broad. And policy, although we tend to think legislative and laws, policy can happen in a whole bunch of different ways, especially with administrative rules and regulations. So it's really those actions that are taken to move an organization or a community forward towards its goals. Health policy happens at all levels. And I'm sure you all have personal examples, probably professional examples. But at the local level, officials have the ability to enact ordinances or regulations that are specific to the community, that meets the specific needs of the community, as long as they're not otherwise prohibited. And we'll talk a little bit about how Larger levels of government can prohibit action by smaller levels of government. But at the local level, there's quite often areas where there's no state or federal legislation or action. And so there's some opportunities to do some really innovative policy work that meets the needs of your community members and helps you to address something that you've identified in your community as an area to work on, as a goal to work towards. Local officials, they're your community members. Again, as a member of my school board, I am a parent in my community. I have 3 children in our schools. I still know I don't know what's going on across all of our buildings, even though we're a relatively small district, but I know these parents. I see them at concerts and at sporting events and at PTO meetings. Sometimes at that local level, it can be a really great thing because you might just know those people and you can go and have a conversation. The downside of that, sometimes you know those people and they're not the easiest people to have a conversation with, or there might be some other just personality challenges that because you know them. But local policymaking often gets overlooked as far as its value and being able to make an impact, but it really is important. And I encourage you all, where you have opportunities, to think about what can we do here now at our local level that'll make a difference. At the state level, really states can enact policy on a whole range of issues as long as that is not reserved to the federal government and it's not prohibited by their state constitution. So there are certain powers that under the Constitution were delegated to Congress. Anything that wasn't specifically delegated to Congress falls to the states. Every state has their own unique constitution. They have their own unique process for amending the Constitution. They have their own process for passing laws. Most of our states are bicameral, meaning you have a House and a Senate. We have a couple that are unicameral. So they all have different steps and procedures on how they take up action. But states can do a lot too, and quite often work this in at the local level to make some policy change can often work its way up to the state level. So at the local level, you've enacted a policy around housing equity, and it's had really great success. Well, now your state level legislators who have identified that as an issue across the state can look at your local work and see how that local policy might be able to translate at the state level. And then at the national level, which is federalism, these are laws enacted under the authority established by the Constitution, including those pertaining to public health. What happens sometimes is you might have a federal law that preempts or says that states and locals can't pass a law that quite often is stronger or sometimes is weaker than what the federal law passed. It preempts action on those laws. So we've seen this particularly around tobacco regulation and tobacco policy. You can also see it in environmental protections. And so it's important to understand where preemption exists. Is it preemption at the federal level, preemption at the state level, and then what can you do at the local level? Anybody have any questions? Give a second. Okay. So let's talk about health policy and public health practice. You guys have, I'm sure, all seen this chart of the domains of the CPH exam, and policy and advocacy is an important part of the exam and what we do. And obviously, it's an important part of our essential public health services. Policy development is a key piece of this cycle. And so it's important that we give it its due and that we understand really that the key role of policy in the work that we do in public health. So how do we make policy? I wish it was as easy as the Schoolhouse Rock. That was one of my favorite videos when I was a kid, but it's actually more like this. So you have a policy formulation phase. This can last a few weeks. It can last years. And part of it is identifying what are the problems that you're trying to address? What are some possible solutions? And how feasible is it? How likely is it that those solutions will actually work in the current political circumstances? Policy formulation, it's really important to have a lot of people around the table who all have the same goal Everybody agrees that there's a problem. We're all trying to work towards the same end. But the more diverse group that you have around the table, the stronger the policy is going to be that you craft, your idea is going to be, and it helps you to gain the support of other stakeholders as you move forward. Quite often, there may be a window of opportunity to move forward legislation given political circumstances. And so sometimes the work you're doing in policy formulation, it can feel like it's taking forever and it's not going anywhere. But then you hear through some of your partners and stakeholders, hey, we have this window of opportunity. Maybe there's funding available. Maybe an event happened that has gotten the attention of your local or your state politicians, so they want to move. Um, uh, and so that's your window of opportunity to take this policy. And so now you're not just responding to this one event, maybe, but you're setting something in place going forward. We've seen some of that, I know, in Michigan around environmental exposures. Obviously, everything that happened in Flint led to some policy changes, but also around PFAS exposures and the chemicals that last forever. There's been a lot of work done because of concern that was raised by the identification of these chemicals in our environment. There was a window of opportunity. There have been a couple of windows of opportunity to do some legislative work, some policy work. Once you've got a policy, you've developed some legislation, you're working through that process, the next phase, and it says here, bridged by formal enactment of legislation. Once you've enacted legislation, you go into policy implementation, which has rulemaking, but also putting it into practice. And then you do a policy modification phase, and policies are almost always modified. How you think a policy is going to work isn't necessarily how it works. And so remember, this is very much like a CQI cycle where you're identifying a problem, you're trying to implement a solution, and then you evaluate that solution. It's just in policymaking, it can be a very different timeline, and you have less control over some of those phases. So the roles of the branches of government, and some of you probably know this, but we'll do a quick civics review. So the legislative branch, and this is at all levels, local level, state level, federal level, you have a legislative branch. In my school district, our school board is the legislative branch. We enact policy. We also approve the budget, so we are appropriating funding. We are making sure that we all agree. We all agree on an identical version of the policy, so identical versions of bills must pass all chambers if you have a bicameral system. And we can override bills vetoed by the executive branch. So, like in a local school board or a local city council, that executive is like your mayor or your city manager. In our case, it's actually our superintendent who kind of has to go, yep, I'm going to put this into action. If he says, nope, I don't want to do it, we have the responsibility of saying we're going to override that, and yes, you are. The executive branch is responsible really for the administrative day-to-day functioning. The executive branch can sign or veto bills that have passed through the legislative branch. They are responsible for that implementation of laws through promulgation and enforcement of the regulations through departments and agencies. And so it really is this balance. If the executive branch can't do something if there's not a law supporting it. But they are responsible for making sure the laws that are passed are enforced. And the judicial branch is responsible for issuing legal opinions that shape the implementation or enforcement of the laws. We all know at the federal level, the Supreme Court can say, yes, this is constitutional, no, it's not. They can base it off of previous opinions or their interpretation of the Constitution, but this happens at all levels. So each of these branches, in theory, is equal. However, over the course of our history, one branch or the other has sometimes had more power than the other branches. I did see there was a question about the window of opportunity when we talk about policy formulations or modifications. Windows of opportunity can open up for both. So sometimes it's the absence of a policy, and we really need something, and now there's a window of opportunity so we can put something into place. Other times, it can be a modification. And so it could be that we have part of what uh, came out of the Flint water situation here in Michigan is we hadn't been doing a good job at all of funding our infrastructure, our water infrastructure in the state of Michigan. It kind of kept getting the short end of the stick when it came to appropriations. And so what happened was as the issues were being raised in Flint and it was being raised in other areas of the state with older infrastructure with their water, our appropriations were modified in Michigan. The governor at the time found additional funding, moved funding from other projects. So now there was more funding available to go to some of our cities to speed up the work on modernizing their water systems. So sometimes that window of opportunity is while you're formulating a policy, sometimes it's when you're like, oh, we'd really like to change this, but there's not interest until all of a sudden there is. So hopefully that helped. Okay. So as I said, these are the key steps and kind of sub-steps in making policy change. So the first is agenda setting, and it's really, how do we know this is a problem? Do we all agree that this is the problem? How do we collect evidence and data to help make sure that we all agree this is what we need to address in a policy? And sometimes it's identifying, is there actually a current policy gap? So is this something we don't address or we don't adequately address, or what's in the policy is no longer effective, so we need to modify it? Or is it that there's policy, but it's not being enforced, which is a different kind of advocacy. But it's important to know what exists and where you might be able to fill in that gap once you've identified the problem. Once you've got your problem identified, you've got some good data, you think you know where you want to go as far as your policy, then you can develop this policy. Look at what other jurisdictions have done. We had this, and I know I'm using examples from Michigan, but that's where I've been for the last 25 years. But when Michigan was trying to pass its smoke-free air law, we had local jurisdictions who had put regulations in place. And those were drawn upon at the state level then to craft our state level legislation. You have to examine if there's possible preemption or conflicting policy. So if you're looking at a state level policy, but there's a federal policy that conflicts with it or preempts what you're trying to do, then you have to really do that advocacy at a different level. And then you're developing that policy language, and there are experts in your community who know how to develop policy language. If you have found a legislative champion, somebody who is interested in working with you, especially at the state and the federal level, they will have staff people who this is what they do and can work with you in crafting that language. At the local level, you can work with like your county attorneys, others who know how to draft this language. There are nonprofits who do this kind of work on specific issues. They can also work with you on the language. So this is where it's really important to have some of those stakeholders around the table from day one so they can help you in thinking about how that policy language might develop. Once you have your agenda and your policy, now it's time to do the fun work of advocacy and policy adoption. This step, all of these steps can take very varied time depending on the situation and the policy you're working on, but advocacy and policy adoption is probably the most varied time frame. I mentioned Michigan's smoke-free law. I think we were working on that for 26 years before it was adopted. So that's 13 different legislative sessions before it actually got approved. So there's a lot of time and effort that can go into advocacy before a policy is adopted. And that's where that collaboration with partners is really important. You want to make sure that you've got partners who can also help monitor any action throughout that whole process. And again, that time can vary significantly. With policy implementation, so congratulations, your policy's been signed, big celebration, now you got to do something with it. So are there any administrative rules or regulations that need to go into place to make sure that the policy can actually be acted upon? what resources need to be allocated. And it's important during this process that you are working with your partners so that just because a policy is implemented and everybody supports it doesn't mean it's going to be implemented in a way that's faithful to the intent of the policy. Sometimes people have different interpretations. So it's important to work with your partners to continue your advocacy work. And part of policy implementation also should involve any reporting measures, which goes into this final phase of evaluation. How are you going to know if the policy and the implementation has been successful? What are the outcomes that you're aiming for? How are we collecting the data? And that should help you identify any gaps or unintended consequences of the legislation, which goes back to agenda setting. So it becomes hopefully a cycle to where we're always working on improving our policies. So there was a question about the ability of the president and removing the US from the WHO. I will be honest in that I've seen a couple of different stories about the authorization to help form the WHO, which we did in 1948. And my understanding is that it wasn't done through law, but through a resolution that was passed by Congress, which is a little bit different than if they had passed legislation making us a member of WHO. Which creates a little bit of a difference for the president to decide whether or not to keep us there. So I think there's going to be a lot coming out over these next few days and weeks and obviously months around the ability of the executive branch to take action outside of the legislative branch. And there are several organizations around public health law that not trying to do an advertisement, but that will do regular webinars and talk about a lot of these issues and have a lot of great resources. So if anybody's interested in some of those specific policies, I highly encourage looking at some of those fantastic national resources that we have as part of our profession. And hopefully they've got the answers for you, because I am not an expert on that one. So, but I've seen several people asking it. But if we're talking about the cycle, well, now if there's some questions about who has the authority to make that decision, if the legislature decided they wanted to say, you know what, no, this is our decision, they could write a law and pass the law. And if they really wanted it, it would be a veto-proof majority to say, nope, this is our decision, not yours. But I don't know that that's going to happen. Okay. So agenda setting and policy development. So how do you define the problem? Issues can be raised by anybody in the community. It can be by your community members, health department. Current policymakers may come to you and say, hey, I'm hearing this from some of my constituents. What are we doing about it? Other partners in the community, nonprofits, community organizations, especially as we're doing more community health needs assessments in our communities. And we're kind of in these constant conversations with our communities about what are our goals. How are we doing things for our community health improvement plan? At least around here, we're finding a lot of things where we could use some policy change and some issues we want to work on. So we're seeing policy definition coming out of that process and others. How is the problem being defined? So are we using anecdotal evidence? Are we using the stories of our community members, of our clients, of our partners? How are we defining this problem? Are we able to collect this data, whether it's qualitative by doing some interviews with impacted community members? Is there any quantitative data? But how are we going to collect this and put together our story? You'll often hear when people talk about advocacy as being able to tell your story, but data is really important. And sometimes you have communities that are impacted by policy who don't feel like they are effective in advocacy and speaking with policymakers. You still want to make sure you have their stories so you can help to be their voice if they trust you to do so. That information is really critical when you're talking policy formulation. And also, how are we evaluating, or if we've got this problem defined, what does this mean for an evaluation of our previous policy? And have we evaluated our previous policies to help then shape this problem definition? Is the identified problem something that can be addressed by new policy or policy change? You know, do we need to go through a legislative process? Can it be an administrative rule process? Is it identifying other resources that we're just not reaching enough people given limited budgets. So it's always important to know what the policy solution could be. Is this something that requires a policy solution? And if it's not, is there another process that we can use to get there? And part of why that's so important is, especially if it's something very time sensitive, the policy process can take a long time. So if it's something that needs a more immediate response, think about what you can do in the short term, and then maybe the policy change becomes a longer term project. Oh, sorry. So let's talk about laws versus rules or regulations. So laws are a system of rules created for the protection or promotion of community health. So it's laws are those actions taken by the legislative branch. Only the legislative branch can pass laws, can introduce laws. So the executive branch is not able to draft a policy, a draft bill. The legislative branch has to author the bill for it to be introduced. Doesn't mean the executive branch doesn't sometimes work with the legislative branch and their supporters in the legislative branch, but you have to have a member of the legislative branch who introduces a bill, who supports a bill so that it will be moved into the process. Regulations are different. Regulations or rules are a set of rules that describe the implementation of the legislation. So regulations come after there is a law in place and it has been passed, it has been signed into law. Now we've got to come up with the rules of how we do this. What's the time frame for compliance by companies? How are they going to have 90 days? Are they going to have 180 days? Sometimes some of that is defined in the legislation. If lawmakers do not want it to be up to the executive branch and to the agencies to make those determinations, sometimes they get very specific in the laws. But other times they'll leave it more generic. So one example in Michigan, we have in our public health code, it requires that we have a health officer to run each of our local health departments. And if the health officer is not a physician, it requires them to have a physician to serve as their medical director. But it wasn't really defined. Does physician mean any physician? Do we need a particular specialty? Does it have to be a physician with public health experience? And so there were administrative rules or regulations that were put into place after our public health code was passed that define who can fill the medical director role, what kind of experience is necessary to fill that medical director role. It's sometimes easier, usually easier, to change administrative rules and regulations than it is to go back and amend a law. So, so just something to keep in mind as far as, do we need to go and work with our legislature to do a whole bunch of work, or can we work with the department, the part of the executive branch that has jurisdiction, and see if we can make a change there? Okay. So policy development. Again, it's really important to review the existing policies in the jurisdiction of your focus. It can sometimes be really hard to find the right policy. Sometimes laws get classified in really strange ways when you're looking at your localities or your states or even the federal code of laws. And so it's important that you kind of do as exhaustive of a search as you can. This is where working with either members of legislative staff or attorneys who know how to do this and are really effective at it can be helpful. Once you've done that review, asking the questions of, do we need a new policy, or is there something we can modify? And again, are there any conflicting or preemptive policies? Like I said before, do policies exist in other jurisdictions that can serve as a model? And even if you found things that look like they would work as a model, how would you still need to adjust that model policy to fit the needs and characteristics of your community? Just because a smoke-free air law was really good and effective in Northern Michigan, in Marquette, doesn't mean it's going to be an effective policy here in East Lansing. We just have different communities and different size of the communities, different number of restaurants and other food establishments, things like that. We also have a college, well, no, both have college campuses, but they're different sizes of campuses. So all of those things that you need to think through. And then you can develop your policy language, and involving your partners in this is really important. One of the challenges of good policy development is that a policy gets enacted and implemented, and then there's some unintended consequences. And quite often, a lot of those unintended consequences go back to the original language in the policy, and those who developed that policy language not knowing enough or not being familiar enough with different circumstances, with different populations who are going to be impacted, and understanding how the language as written might have a negative effect on some populations or others. So that's why having your partners there, they can read through it and help to make sure that the language is as appropriate as possible. So when we talk about health policy development, most health policies have or address at least one, or if not all of these elements, that's called the iron triangle in some publications. So the first, when we're talking health legislation, health policy, is access, which is the ability to receive needed services or resources. So does the population that you're aiming to serve through these policies, do they have access to receive needed services or resources? It doesn't make sense to support a tobacco cessation program at your local high school if you don't have public transportation that goes to the local high school, and the high school has so many other things scheduled that it's really hard to schedule a consistent meeting time. And school is kind of not a great place for a lot of people to go. They don't necessarily feel comfortable. So will the people that you're aiming to serve have access? The next piece is quality. So thinking as you're talking about policy, the extent to which the services will be provided in a safe, effective, timely, efficient, equitable, and patient-centered manner. How are we not only going to, in this policy, make sure that our population has access, but that what they're receiving is a quality service? And then what's the cost? How affordable are these healthcare services? Again, if you're wanting to offer a service or a program or an intervention in a community that is lower socioeconomic status, what are we also going to do to make sure those costs are kept low? Or maybe the cost of the program is low, but we make these decisions where the other costs of being able to participate, some of those indirect costs are actually kind of high. They have to take time off work, or you would need childcare or things like that, which become prohibitive. Those concepts of the iron triangle very much feed into this idea of health in all policies, because you're wanting to make sure you're thinking of all populations and all of your health policies, but kind of flipping that on its head, it's also how do we incorporate health, or how do we think about health in all the policies we do? So not just health policy, but how are we incorporating health and health outcomes into housing policy, transportation policy, workforce, and workplace safety policies, nutrition, obviously. Probably the most common is, when we're talking about environmental policies, and really how does health intersect with that, and thinking about health for all of the communities. And so, again, health in all policies is something that is still new in a lot of places. I think there has been hesitancy in some areas to really push this forward, especially after some of the pushback after COVID and actions that were taken. But I have seen lots of local examples of our health departments, in particular, working with law enforcement, working with emergency planning, working with environmental services, to think about health and health outcomes as part of the policy work that they're doing. Before I talk about advocacy, any questions kind of about policy and policy development?
We don't have any open questions at the moment.
Just wanted to double check. Want to give everybody a chance before we moved on. Thank you, Ashley. Okay. So if you're going to be advocating for a policy, you've worked really hard with your community members and you want to advocate for a policy change, it's really important to know the political environment, and not just the political environment specific to the level of where you're planning to take action, but it's also good to understand some of the larger political environment. Who are your current policymakers? What is the political environment around this issue? Who will support your proposal? Who will oppose it, and why? And making sure you're engaging your community stakeholders to have a full picture of the political environment. Who are your current policymakers is really important, and quite often it's important to, when you have the chance, attend some of their events. Most legislators at a state or federal level will have periodic, coffee hours, town hall meetings, where you can just go and they'll talk about issues. You can hear them talk about it. You can ask questions. So it's kind of nice just to go and get a sense of who they are and where they're at. When you have the chance for policymakers to come and visit your work, if you're working in governmental public health, sometimes they will come and visit. That's also a good chance to just kind of hear them talk about issues that are important to them. It's also valuable if you have state associations that you're part of, professional associations. A lot of, especially state level associations, definitely national associations, will have knowledge of key legislators and what they're interested in, what they'll support, what they won't, and their staff can give you some of that information and help you out. Particularly at the local level, but also at the state level, your community members probably have also done some of that work. Your community organizations that are working on these topics have done some of that work, and can provide you with a fuller picture of what the environment is. When you're thinking about the political environment, and it's really weird in some ways to be doing this presentation the day after the inauguration. So, our political environment is changing drastically right now, especially around public health. And so it's important to know what the specific issues of interest are. And so if you're advocating for a policy around nutrition, who's in favor of doing some work around nutrition? And sometimes it's not a party issue. It's much more ideological. And that's where you get into who will support it and who will oppose it and why. It's not always the parties that you expect. Many years ago, when I was working as a health lobbyist, we were doing some work around pesticides and trying to limit some of their use around kids in our schools, and making sure that the notifications were done by our school districts. And we were expecting the vote to be completely on party lines, and we actually had a couple who went against their party and voted in support of our bill. And we asked them later why, and both of them had independently talked to their physician about these chemicals and asked them what they thought, and both agreed that they shouldn't be anywhere around kids. And so since their doctors said these are bad things, they listened to that. So it's good to have those conversations and not just to make assumptions about who will support in this political environment and why. How long does it usually take for research to culminate in policy? That's a good question. So, it really, that's a good question. It sometimes depends on what that window of opportunity is. So if you've got some research that's coming out, and let's say, research that shows an intervention is particularly helpful and successful, and it's been tried in a bunch of different communities, and this is something that really should be supported across the state, and you've got all this evidence and all this support. If there's a window of opportunity where this is a problem that's been identified, you have some legislative champions who are like, we absolutely want to do this, let's do it. You have some data to back it up based on research, you've been doing all this work. It can go into practice, it can go into policy pretty quickly. But if if you have research and people are like, we don't care at the policy level, you have a hard time finding a champion, there's not agreement that this is actually a problem that people want to invest time in, it can take a lot longer. So it's quite often, as with a lot of things in policy development and implementation, it's quite often a timing and hitting it at the right time when there's interest in that topic. The other thing to realize, and I should talk about this in the policy development, but we'll talk about it here, at the federal level and at most state levels, bills are often introduced multiple times. So typically what happens, and I'll explain what happens at the federal level, and lots of states have the same cycle. A bill that's introduced at the beginning of the legislative session. So the legislative session for the federal government starts in January of odd numbered years. So we're in a new legislative session right now. A bill has to be introduced starting in January, and it can be introduced anytime between now and December of 2026. And that's a bill for that legislative session. However, once the legislative session is over in December of 2026, all the bills that have not been acted upon, they haven't made it all the way through the legislative process to go on for signature. All the bills that are not completed, haven't completed that process, are dead. And if somebody really wants one of those bills to pass, but it didn't get far enough in the process, they can reintroduce it in the new legislative session. So you might have a policy that's got some support, but you might be able to build some support over time, over legislative sessions, to where you're finally able to move it all the way through the process. That's actually what happened with Michigan's smoke-free law that took so long. Okay. How would you approach the idea of bias or conflict of interest in policy advocacy and development or in rallying support? So, my experience when you're talking about bias or conflict of interest, I think when you bring partners to the table, one of those early discussions has to be why everybody's at the table. Why are you here? What are you trying to get out of it? Are you here because it's important to you personally? Are you here because it's what's funding your job? Are you here because of a larger community good, something that you've seen patients struggle with it? I think you have to be honest, and I think you should expect everybody to be honest. And so thinking about how you have that as part of your planning, as part of your formulation, I think is really important. I think there's always an assumption, and we've run into this when it's been folks in governmental public health talking to their county commissioners or talking to their state legislators about work that the public health agency does, that the only reason they're talking about is because they want more money. And what has been really successful for most of them has been, yes, our agency receives funding to do this work. Here are the benefits we're seeing for community, which is why we think it's important. We're not here today asking for any more money. We're just trying to educate you on the value of this program and our hope that you will keep it going. So I think there's ways to have that conversation. There are going to be some people who are going to see that you're biased no matter what. But with your partners, you have to have that honest communication, and you have to know and be prepared to answer a question about bias when you meet with policymakers. There was also a question about policy development to implementation takes 8 to 10 years. I am never going to argue with an RWJ policy fellow. I think that's probably dead on. I think it probably varies a little bit at state level versus federal level, but 8 to 10 years sounds probably pretty accurate. There are some things that go really fast and some things that take forever. And then one more question. So policymaking and research seem to follow similar steps of reviewing what's presently in place, decide there's a need for an intervention, developing and enacting, and then evaluating the intervention or policy. But an intervention may not always need to a new policy. Is that on track? Yes. So when you're looking at it, there's a lot of overlap between policy development and evaluation and program development and evaluation. The biggest difference is when you're talking about program development and that kind of continuous review, what are our gaps? A lot of that, not all, but a lot of that is under the control of you and your partners, of your agency, of the stakeholders that you have. Can we find the resources? Is there support for doing this? But you have more control over that. When it comes to policy, you are relying on these local policymakers, state policymakers, federal policymakers to make those changes. And so you have to convince them that these changes are important and necessary. And that's probably the biggest difference in those two. But there's a lot of overlap and similarities. Okay. These are good questions. Thank you, everybody. Okay. And again, if we're going to talk about data, and again, this is going to be similar to some of what you see in program development, you're going to want to make sure you're collecting data from diverse sources. There's good quality to it. What digital tools and resources do you have? Especially when you're talking policy, you want to think about the burden of not doing something. So what's our current status quo? What's the burden? Why do we think that a new policy will help to alleviate that burden? There's really looking at kind of cost analysis. What's it going to cost? What's the impact going to be? Why is this better than what already exists? You need to think about communicating in lots of different ways. Some policymakers like others, some like with charts and graphs and all sorts of visual stuff. Others want real life stories. Others want just the money piece. So it's learning who your policymakers are and what data is going to speak to them and making sure they have easy access to it. And then how are you managing that data across different sources? So you might have some data, your partners might have some data. How are you integrating that across all of your partners? How are we protecting the privacy when we do that? And how does the data flow back and forth? Over all of that, you're going to have policymakers, people in the executive branch, the media, publics, members of the public who are paying attention. They're all going to want data. And so you need to know what data you're using to support your policy. How is it interpreted? Like you need to be very clear on your messaging when it comes to data because everybody's going to want it if this is something that's kind of up for debate and why. But you also want to make sure that you have used data to inform your priorities, inform your decision making, that there's going to be accountability. And that there's a source of data, then that when you put the policy into place and you're looking at the success of it, you have a place to start that is rigorous. So this gets to the question a little bit on questions of bias. Most governmental employees, not just in public health, but also a lot of nonprofit employees, those who are funded by federal grants and quite often in state grants, are limited by the terms of their job as far as what they can do to advocate for a policy. And this gets really confusing. And I've heard different attorneys give different interpretations of lobbying versus advocacy versus education. And so it's always important to talk with your supervisor, to talk with the authorities within your organization about really what are the boundaries of what you can advocate for, what you can do. But the other thing I will also say is you are all private citizens, you're private individuals living within the United States. And there are also sometimes opportunities just as your own person to speak up. So it's always good to have these conversations with your partners, with your supervisors about kind of what are those boundaries so that you don't get yourself into any trouble, but also can be effective. Typically, the definition between lobbying and advocacy is lobbying is if you are asking a policymaker to take action on a specific piece of legislation. So I want you to oppose House Resolution 25 because blah, 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 blah. Or I want you to support Senate Bill 35 because of, all of this. Whereas advocacy is speaking up about a topic. Speaking up in support of vaccine requirements for school attendance. Speaking up for funding for our emergency preparedness services. It gets sticky if you're not necessarily talking about a piece of legislation, but there is legislation that's out there and pending. So it's important to be very specific in your messaging that you are there to talk about the needs that the community has identified, that you're there to talk about the impact of a certain issue in the community, that you're there to talk about the value of action taken thus far and why it should be continued, things like that. In Michigan, we talk a lot about educating policymakers. So really almost more doing presentations on topics, particularly to our county commissioners, but also to our state legislators, about questions of interest to them, about topics that they're getting asked about so that they're prepared, but also that we can share information with them. It can be gray areas. So I strongly recommend making sure that you're speaking with people who can help guide you through that if you're interested in advocacy. But this is where your partners can also come in really handy. A lot of your community partners aren't going to be governmental employees and aren't going to be under the same restrictions that you might be. So what resources, what volunteers, what networks did they have to do some advocacy, but also making sure you know what limitations they have. Again, this is kind of a little bit of advocacy versus lobbying. Again, quite often it's vote for or against something. Written testimony can be a little bit of advocacy, a little bit of lobbying, depending on where that testimony is shared. And the federal government, as well as states, do require lobbyists to register. But then the advantage of that is if you're able to work with a registered lobbyist who can help you navigate that process and who is able to kind of deliver the message. Yeah, so that's the question. Don't lobbyists have to be registered as a lobbyist versus an advocate? Can be anyone. So anyone can lobby. You can lobby as an individual. But if you are a registered lobbyist, you are registering on behalf of a group of a group or a company or an organization of some kind. So registered lobbyists aren't just speaking for themselves. They are speaking for other people. And that's really that's the difference between a registered lobbyist versus anybody just speaking up. I was a registered lobbyist for a nonprofit doing health policy stuff for a while. I always joke that I was a lobbyist with a small L, not a big L, because I didn't get paid like what you think of as a lobbyist. But because I was speaking for the organization, I was speaking on behalf of the organization and encouraging legislators to take action based, from that organization. I was registered as a lobbyist. Okay. And by the way, the term lobbyist comes from the people who always stand in the lobby outside the actual physical chambers for the legislature and trying to catch the legislators to talk to them. So it's really a much more active, engaged on a daily basis kind of process typically, but it's really about specific bills and votes that they're going to take. Okay, this is the attempt to get the legislative process on one slide, which makes it way oversimplified, but I want to walk through at least some of what's here. As I said, for a bill to be introduced into a legislature, you have to have at least one bill sponsor. Typically, there are multiple sponsors. They are listed on the bill as it is introduced into the House or to the Senate. Sometimes you want to be very strategic about who your co-sponsors are. If you can get co-sponsors from both parties on your bill, that's not a bad thing, unless you're in a very non-partisan, like the parties don't want to work well together at all. And then sometimes that's not a good thing. So it's important to think about who your sponsors and co-sponsors are. Ideally, it's great to have a sponsor or co-sponsor who is either the chair or the co-chair of the committee where the bill is probably going to go. Because if you have one of the leaders of the committee as a co-sponsor, they'll probably make sure that the bill actually, the action is taken in committee. Once a bill is introduced, it is assigned to a committee. Every state has a committee that the chamber leadership can assign a bill to, and there's never any action taken. Like there's always a committee that almost never meets, and it's where bills just go to just sit and wait until the end of the legislative session. But once a bill is in the committee, that bill is the responsibility of the committee. That committee can do nothing with that bill. They can decide to hold hearings on that bill. They can decide to restructure that bill. So often you have some negotiations going on in committee. Are we going to just like sit on it? Are we going to take any action? Are we going to just vote? Are we going to try to shine this up to make it something we want? Stakeholders can usually give input during this time. Sometimes committees have special treatment of certain bills if it's something that's a priority for the leadership of the chamber, if it's something that's a priority that, that's been figured out with the executive branch. Sometimes it can move a little faster. But a lot of bills never make it out of committee. So they get assigned to a committee, but there's never a hearing, there's never any action, they don't go anywhere. If a bill is passed in a committee, it goes to the full legislative body where it's put on the agenda. And again, more negotiations can happen. It can be amended out of committee. So you've got more stakeholder input, more compromises. And then once it's ready, according to that chamber's leadership, everything's been negotiated, then it can be put to a vote. If it passes, the whole process is repeated in the second legislative body if you have a bicameral system. For the states that have a unicameral system, you only have to do this once. But it has to be repeated in the whole second legislative body. And if the second chamber makes substantial changes to the bill, they don't just like pass it, as written, then if you have two different versions of the bill, then there's a process in place for the leadership from the two chambers to negotiate the differences in the bill. They come up with a final version, which then has to pass both versions of the House. Those don't have to go to committee, but they have to pass both versions of the House and the Senate before it can go to the executive branch to sign or to veto it. So it's a lot of steps. It's a lot of steps. It's a lot of steps at the state and the federal level to get a bill through a legislative process. This is much simpler for most local action. The difference being in a lot of our big cities, it can take a process, but those are typically unicameral. Those are unicameral, so you don't have a House and a Senate that you have to worry about. But in bigger cities, sometimes there's just a longer process to get things moving. Okay, questions about the process? That's why, and it's been a while since I've seen the stats, but I think it's something like 93, 95% of bills that are introduced don't go anywhere. They don't make it out of the legislative session. So actually the number of bills that are signed into law is minuscule compared to the number that are introduced. Oh, so unicameral or bicameral, sorry about that, Bertha. So bicameral is when you have two legislative chambers. So typically, if you think of the federal government, you have a House and the Senate. Most state governments have a House and a Senate. There are a couple of states, and I cannot remember them off the top of my head, and I apologize, that have a unicameral form of government, meaning instead of a House and a Senate, they just have a House. And so that means that process for policymaking only has to be completed once. The other thing to realize too is that a lot of states have what they consider a part-time legislature. So they might only meet for a specified number of months during the year, like they might only meet for 3 months at the beginning of the year, and then they don't do anything else the rest of the year. Or they might only meet like in even numbered years or odd numbered years, and then they don't meet the rest unless there's some emergency session that gets called by the governor. So the opportunities for action can be really limited depending on the calendar for your legislative branch. Nebraska is the only unicameral. Okay, thank you very much, Christina. Okay. All right. So if you were successful, you got your policy through, throw a big party, because that's a lot of work. Even at the local level, it can be a lot of work. So now what happens? Well, now you're going to talk about rules and regulations. How are we going to actually take this policy and put it into practice? And that's the responsibility of the executive branch. When laws are passed, particularly at the federal and state level, those laws will identify which executive department is responsible for that law. Administrative rules and regulations have the force of law. Is a whole process with administrative law courts for those rules and regulations to be challenged. Sometimes those make it into things like the circuit court and to the Supreme Court, but there's a whole separate piece of law that goes into administrative rules and regulations. Again, the specific processes will vary across levels of government and different states and different jurisdictions. But typically, if you're going to create administrative rules and regulations, there will be some sort of public notice of the proposed rules. There will typically be public hearings or a chance for public feedback, and to agency officials. And if there's significant changes made, so they rewrite huge chunks of the rules, the cycle repeats. So they will do a new public notice of the proposed rules with the revisions, more chance for public feedback, until most of the changes are done, and then they can go into place. There are opportunities for lobbying and advocacy within this part of the process as well. So your lobbying or your advocacy is not done when the policy passes, even though you've thrown the party, which I really hope you will, because again, it's a lot of work. So what needs to be considered? What are the things that need to happen during implementation? It's important to identify resources that have been allocated to the implementation of policies. Do we have funding appropriated? Are we going to need to hire new staff or add staff, or add to the existing staff? Is this something we add to existing programs or services, or are we creating something new? How can our partners or stakeholders help with the implementation? Probably what it feels like I see most often is that bills will pass and then there's no funding attached to them to make sure they actually happen. Or there's very limited funding that is not anywhere near sufficient given what the cost of that program is going to be. And so it's important that you think about the resources that are needed and that you advocate for those resources so that the policy can be implemented as it needs to be. You need to make sure that everybody is clear on the goal of the policy, and that should be stated in the language of the law as it was passed. But sometimes that's not really clear. And so it's important to make sure that everybody who's responsible for the implementation understands the goal of the policy. And if there are any other related policies that you need to consider as this new one is implemented. So how is this piece related to other pieces of existing law, and how do we make sure that they all fit together? Sometimes it's been known to happen. You might have this new policy, and with all the revisions and the amendments, now something in there contradicts something over here. And you kind of have to figure out an implementation, like how does this get worked out, or do we need to go back and amend the law, and how do we navigate this situation? I want to say policy implementation, before we talk about evaluation, it's typically the most defined as far as the time that it's going to take. Most states have a standard that policies go into place 90 days, 180 days, unless otherwise specified in the law, that it goes into effect sooner or later. So, if it says that the policy goes into effect in 90 days, you've got 90 days to figure it out. Because then the policy is in effect, and if you're not ready, then you might not be enforcing the law in the way it should. You might not have the resources in place. So that's probably the most time-constrained part of the whole process. But it's also where a lot of things can change if the language of the bill wasn't clear, if the resources haven't been allocated, or if it's not a focus of the agency that's responsible for carrying it out, and they're like, we'll just take care of it. So it's important that you and your stakeholders monitor the implementation and make sure things are done in the way that you were aiming for them to be done. Okay. So policy evaluation. So again, it's how do we know if we met the goals of the policy? So way back when you were identifying the problem, you were talking about what needed to be done, how do we know if we've actually achieved those things? So key questions, does the policy improve those metrics that, we had the data that we used to define the problem? Are we seeing improvements when we're looking at some of the new data, looking at similar outcomes. Are we finding things like disparate impact and cost? Are we finding that, yeah, this policy is working really well for our suburban community, but for our urban part of the community, it's not working well at all. So what are the differences there? It's really important to make sure that the underrepresented groups, underserved groups in your communities are not underrepresented in your evaluation or your evaluation plans. How are you really looking at the whole community that was intended to benefit from the policy? Make sure, like you would with anything else, that you have a plan of analysis that follows the program planning method. Make sure you're not just haphazardly trying to go back and find data later, and then you figure out how to analyze it. And try to make sure you're focusing on gathering good, clean data. If you've developed good working relationships with your community stakeholders and partners while you're developing the policy, they can help you do this evaluation phase. They can help you with collecting the data that you need to make sure you're meeting your goals. And hopefully that you're not having to wait too long to be able to get that data so that you can really kind of, not quite in real time, but as close as you can get, you're evaluating the impact of the policy. So again, it's always clear, what was the aim of the policy? Do we have a definition of success? Which is sometimes a little bit different than the goal of the policy, but what defines success for this policy? And sometimes it's going back and looking at the record of this policy. What evidence did they use when they were debating this policy, talking about the policy? And did the rationale for this include a clear measure of success? Is this based on is this an evidence-based intervention? So are there already tools and measures? If not, is there something we can use? And again, what data did we rely upon to form this policy, and can we still use that data to show difference over time? And are we able to collect the data needed to assess the success of the policy? There's so many data sources that we use in public health that are outside of our control, that are secondary data sources that are incredibly useful and helpful for defining a problem, but we're not collecting the data. We don't have any say over the time frame for that data. We don't know how long until it's available, and we might not be able to parse out that data the way that we want. So are we able to collect the data we need to assess the success of the policy? Not health, but being a local school board member, we deal with this all the time, in that we'll make some changes in our curriculum or take other action. But a lot of the data that's collected from our district is through standardized tests, and we don't have any ownership or really any role in what data is collected, nor with what is shared back with us to be able to determine success. So we have to try to cobble something together to feel like we can see if the decisions we made were good decisions. So some different methods for measuring the impact of a policy. So cost analysis is really looking straightforward at what are the costs, both direct and indirect. The indirect can be hard to encapsulate sometimes, but really cost analysis is, does this save us money? Does it cost us money? What's that analysis? Cost minimization is if you're comparing two different interventions relative to the intended outcomes. So if you're comparing comprehensive sex ed to abstinence-only sex ed relative to teen pregnancies, that would look at given the cost of the two models and given the outcomes, how are we doing? Cost effectiveness is a little bit different. So cost minimization is which one's going to cost us more or less, and can we get to similar outcomes? Cost effectiveness is where the outcomes of the intervention differ. And so you're looking at cost per, like, kind of that unit of change, however you define a unit of change, which is really hard when we're talking health outcomes for a lot of things, especially prevention related. But it's really that investment of money. Are we spending our money in a better way? Are we, even if it's more money, did we have a bigger impact? So cost minimization is really looking at what's the least amount of cost to get an intended outcome. Cost effectiveness is more of a ratio. Cost utility analysis is more about the outcome measures quality of life, physical and mental health, social functioning, and looking at the cost. If we have an intervention and we're looking at these bigger things of, are you able to not use health services as much? If you're able to function socially, you're able to have at least a part-time job, you're doing these other things, then those costs were useful. And so it's really looking more broader, not just health outcome, but broader outcomes. And then you have cost benefit analyses. These are all in some ways very similar, and it can be really hard in describing when you're talking to policymakers. You need to be clear about defining what you're comparing, because often when I've talked to some different policymakers, they tend to confuse a lot of these. And so I tend to not use these terms when I'm talking to policymakers. I tend to describe what it is that we found. We compared these two different interventions. We found they both had similar outcomes, but one cost half as much as the other. They don't need to know which type of analysis that is, but this is important for you to think about. And the type of method you use should be dependent on the type of outcome that you're looking to measure. Throughout this whole process, and I wholeheartedly believe that ongoing, continuous involvement of your partners and your stakeholders will make all of your policy making better. And I think make all your programs better. Like, I just think what we do is better when we've got people around the table. So make sure you're checking with community partners that what you think is success of a policy is the same as what they think is success of the policy. And policymakers, once you hand over the bill and it goes through the whole legislative process, what seems like the definition of success that you started with you might not see it in that bill. So how can you still align the goals of your different stakeholders with what was actually passed and get to all of that in your policy evaluation? And it may be that you evaluate the current policy versus what your goals were, so that you can say, we still have a policy, we still have a gap. We need to improve this policy because we still have a gap and we haven't achieved our goal with the way the policy was written. As I was saying before, consider data from a variety of sources. National data sets are really super helpful, but timeliness, applicability to your community can be a concern. Qualitative data from stakeholders and beneficiaries can provide context for your evaluation. You may see that, there's some improvements in health outcomes, but if the community members are saying, we don't like this any better than what was here before, they're not sure they're going to stick with it. They don't really support it. You're going to see some attrition. That's important. And you need to have that information when you're doing your evaluation. And again, when possible, try to align any data collection for your policy with work that's already underway. If you're already working with community partners to collect some other data, or you're in the middle of your community health needs assessment, how can you align what you're trying to do to evaluate your policy with some of that other work? Any questions before we get to my practice questions? Because I know I threw a whole lot at you. Okay. Ashley, are you ready?
I'm ready.
Okay. So first step in the policy process typically is
Give everyone about 15 more seconds. All right. Looks like B. We have 86% saying B.
all right. And that is it. You've got to define the problem. You can't really do the policy analysis, develop those options, or really even consult with anybody if you haven't defined what the problem is that you want to solve. Okay. Which of the following best describes the power of a local jurisdiction to independently regulate public health, safety, and welfare?
Even if you don't know this one, get in your guesses. We'll wait about 10 more seconds. Molly will talk through the answer. All right, I'm going to end it here.
Yep.
So we have a little bit of a mix. It looks like the highest is 37% with home rule, but D, self-administration is coming in pretty close afterwards. So
And shame on me because I used to have this term in the presentation and I edited it and somehow I took it out. So I will apologize for the unintentional trick question. So home rule is typically what is discussed or is the term that's used when we're talking about the power of local jurisdictions to independently regulate anything, but that includes public health, safety, and welfare. And double shame on me for not making sure that term was included because Michigan is a home rule state, which means that our local health departments operate independently of the state health department. They are their own independent entity. They're governed by their county commissioners. They still have to follow the laws as enforced by the state health department, but they are separate entities. So preemption means when local governments are not allowed to regulate something in their community because it's been preempted either by state or federal law. Okay. Which of the following phases of the policymaking process includes a window of opportunity? And I know I said this can happen in a couple of different phases, so which one was specific in that chart?
right, let's see. Okay, so we've got about 49% saying policy formulation.
Yep. So really, there's some chances sometimes with modification, but really the best answer is that policy formulation when you really see that window of opportunity. And that's the part in that chart where it shows up the most, where you're able to formulate a policy. And I will tell you, there are times when you have a policymaker who says, we're hearing this is a gap, work with us and we're going to develop a policy because they think they can move it quickly. Implementation is really beyond when you'd have a window of opportunity, and implementation can't happen in response to a window of opportunity, and rulemaking is really part of implementation. Okay. All right, so an example, in 2011, ARC found that low-income individuals experience more barriers to healthcare and receive poor quality of care. The best short-term recommendation for addressing this disparity is to do which?
Right. We're gonna go with D. 81% said D.
Yep. Especially when it's uh, some of the research that has come out in identifying these disparities in care. Um, that's a great jumping off point for you to bring your community together and say, help us to understand what's going on locally and what we might be able to do locally to address our highest priority needs. What are some policies? This even can feed into, what are some programs, but what are the things we can do to make a change for the good? All right. One more question. Can federal environmental laws allow states to make parallel environmental laws?
All right, about 15 more seconds. All right, Molly. This one,
Yep.
yep, we've got a mix, but C is probably the one with the largest amount. So
Yep.
good job, everyone.
Good job. So yes, states, federal environmental laws have to date, and given recent Supreme Court cases around like federal rules and enforcement, um, like this is a question that's no longer on the test, which may be good because I think some of that interpretation may be changing. And so might end up taking this practice question off. But typically states have been allowed to make environmental laws as long as they are no less stringent than federal standards. So states can't make it easier. We can't make environmental regulations easier than what the federal government has made. You can make them tougher, but they can't be any less stringent than federal standards. Um, and this question about preemption and what states can do and what they can't, has really been at the crux of some challenges these last few years, both around reproductive health, but also environmental law and some other regulations as far as, states have often or sometimes relied on what the federal law is, so they haven't updated their state law. But then if the federal law or the federal decision goes away, now the states are kind of left trying to figure out what to do. And so this is an area that there's lots of work going on, and I think there's lots of confusion going on. So the state can have, so Christina asked, why would the answer to this question not be number one? So states are allowed to make parallel laws as long as they are no less stringent than federal standards. They don't have to be more stringent. So it's not a case where you can only make a law if it's tougher. You can make a law at the state level that says the exact same thing as the federal level. So it's no less stringent, but it's not more stringent. It just says at the state level, we're going to hold you to the same standards as far as the state as the federal government will. And in some areas, states have done that when they are unsure if the federal standard is going to be upheld. So if they're concerned that the federal level may be eased, and they know that going forward they can have a more stringent level, they'll set it where it's at. So there's this little difference between no less stringent and more stringent. And it seems like a little thing, but honestly, it's complicated. Oh, that's a good question. Okay, so for example, states can allow marijuana use, but at the federal level, marijuana is illegal. Yeah, that's a fun jurisdictional question going on right now. And um, it's a question of possession versus selling quite often, depending on the different state statutes, and the regulations around who are able to sell cannabis versus use cannabis. Um, and what that means at the federal level. And it's what has happened, right? You have this discordance between state laws and federal laws. Um, is that you have had different administrations take a different tact on whether or not they're going to direct the Department of Justice to um, and really to focus on enforcement of that piece of federal law. Every executive branch, every administration makes decisions on to what extent they are going to focus on enforcing the laws that have been passed. So, for better or worse, there have been times when administrations have been like, we know that law's on the books, but we're not going to really do much about it. And so there are lots of concerns about that approach, but there are also a lot of laws on the books, and we don't necessarily have enough resources going to our agencies to enforce everything to the fullest extent that they should. It is confusing, Brenda. It really is. So option B is incorrect because you can't set anything that's less stringent. It has to be at least the same, so no less stringent. And it can be more stringent, but it doesn't have to be more stringent to be allowed.
Yeah, I think it's the more stringent versus less stringent and no less stringent, I think is the part that's really confusing people
Yeah.
on this one. Yeah.
No, I know. And it's
Yeah.
weird because I remember when I first did policy stuff and I was like, that makes no sense. And it's this really it almost feels like semantics, but it sets that floor. You can't make it less stringent. You have to be at least no less stringent. So just think of it that way, is that you can't undercut the federal standard. You have to at least be the same as the federal standard.
Yeah.
So any other questions? I know that was confusing. I hope that helped to answer those. And I know
I
that
think it's good to talk through that one though, because in
yeah,
case something like that comes up on the exam,
yeah.
you've talked through it. So I think that's good, Molly. Thank
And
you.
as I said, some of this is changing rapidly as courts are interpreting policies in different ways, and states and locals are taking some different approaches, and so there's a lot of pushing of these relationships right now, and so it can be confusing. I encourage all of you, wherever you can, to find somebody in your organization or in your school who, like, this is something they pay a lot of attention to and can help when you have a question, because I actually enjoy this stuff. I'm one of those policy nerds that is fascinated by how some of this works, and I find the last couple of years very confusing. So, any other questions?
Does not look like it.
Well, I'm happy to give everybody half an hour because I know how valuable your time is. And I know this was a lot, but I wish you all just the best of luck in going through this exam. And yeah, if I just hope you enjoy it and didn't find it too horribly confusing.
All right. Well, thank you so much, Molly. And everyone else, we will be back on Thursday. So the next section is health equity and social justice. So we look forward to seeing everyone back on Thursday. Thank you so much. Have a great rest of your day and stay warm.